Good morning and welcome to the third of our State of Health events for the week as we explore how the health sector delivers services to meet the needs of all Victorians. My name's Tom Simonson and I'm the CEO of the Victorian Healthcare Association. To start, I'd like to acknowledge the traditional owners of the lands on which we're all meeting today and pay my respects to elders past, present and emerging. And where I am, that is the people of the Dja Dja Wurrung. As well as beaming into many different health services, offices and homes across the state, it's also important to remember that we're broadcasting onto the lands of many different traditional owners. And I continue to be delighted to see our sector building strong relationships with their local Aboriginal communities and keeping traditional owners at the centre of their programs. Over the past 2 days, we've had the opportunity to reflect on several key areas within the sector. On Monday, we took stock of the lessons from COVID-19 and explored what they mean for the health sector in 2021. We also explored another big challenge of 2020, bushfires, and I'm grateful to all of our guests who shared their insights and expertise. Yesterday, we focused on delivering healthcare in the community, and I want to reiterate the words of Emma King, the CEO of VCOS, who joined us for a conversation and reinforced that the community health sector was perfectly positioned to support the Victorian response to COVID because of their relationships with the community, and also reflecting on the relationship between our acute system and our community services system and how important that has been for supporting vulnerable communities during the pandemic. We also explored the rise of telehealth and took a look at programs being delivered by community health services and hospitals. And today we're exploring some of the different parts of people's lives that the health sector supports, from the growing mental health needs of Victorians to our ageing population, to working with people who with disability and their carers. We'll soon be hearing from two ministers involved in these critical areas of healthcare and reflecting on the progress we've made to date, as well as the progress slated for 2021 and beyond. Whilst COVID-19 may have grabbed most of the headlines this year and a lot of our focus over the past 12 months, the sector has continued to support a busy reform agenda across mental health, aged care and disability. As the sector continues to deliver quality care alongside implementing changes brought to light by 3 Royal Commissions, a Productivity Commission report and countless other changes happening across the sector, the VHA continues to work alongside our members to help you navigate the change. In 2020, we've continued to advocate on behalf of members to state and federal governments in these key areas and others, and through these discussions have been able to secure additional funding and support for our members as they embark on this important journey of reform. As the Royal Commissions at state and Commonwealth levels head towards their final reports, we're continuing to work with you to understand your ongoing needs and identify opportunities to support you through policy, advocacy and project delivery. In 2020, we delivered a range of forums and projects to bring the sector together in these areas, including the series of mental health sector forums, which many of you would have attended and which we hosted with Mental Health Victoria. Over those 4 events, the VHA and Mental Health Victoria were able to capture innovative programs across mental health and provide members with an insight into the plans for reform. And I just want to call out the fantastic partnership we've been able to build with Mental Health Victoria and thank in particular the CEO Angus McClelland and the board chair Damien Ferry, who's also the CEO of one of our member organisations, Star Health. So thank you very much to both of them and to the team at Mental Health Victoria. It's much easier to work in partnership on complex areas such as mental health than on our own, and I think we're stronger together. The sessions on mental health were developed with Deloitte and were focused on areas such as bringing lived experience into the conversation, learning from each other and taking action. They also gave us the opportunity to talk to leaders in other parts of Australia and in New Zealand. At the same time, we've been bringing together public sector aged care providers on a number of occasions and providing members with regular briefings on the Aged Care Royal Commission. While these issues are only part of the broad areas within Victoria that we and our members support, they are issues that touch all of us at different points in our lives and continue to be priorities for members of the VHA from across the sector. Finally, we've continued to collaborate with a number of partners to build the capability of our sector and others that we work closely with. One example of this, of which I'm particularly proud, is the Tri-Peaks collaboration with the drug and alcohol sector and the child and family services sector, recognizing the enormous interdependence between those sectors and ours. The Tri-Peaks webinar series and cross-sector mentoring program is developing linkages between the three sectors, supporting board members and good governance, and sharing practice, expertise, and evidence. In 2020, the collaboration delivered an enormous 19 webinars, attracting audiences in many cases of more than 100 from all three sectors. And we've also been able to support 15 mentoring pairs from across the three sectors. The advent of COVID obviously brought some challenges to the project, and a lot of the plans that we've had to put on hold and replace with other things, but the VHA and our partners, the Centre for Excellence in Child and Family Welfare and the Victorian Drug and Alcohol Association have continued to work throughout the year, and I thank them and their CEOs, Sam Biondo at VADA and Deb Sabaras at the Centre for that partnership, and I think it's a great sign that sectors can work together in the joint interests of their members and the communities that they support. With the global pandemic highlighting the need for further support in these areas and identifying some of those weaknesses in how we are all funded, as well as opportunities for innovation, the next 12 months will continue to see programs being developed and delivered by the VHA and our partners in these areas and more. With this in mind, we've invited two ministers to share their reflections on 2020 and on the sector. Firstly, I'm delighted to introduce a message from the Deputy Premier and the recently appointed Minister for Mental Health, James Merlino.
I'm James Molino, the Victorian Minister for Mental Health. Welcome everyone to this special VHA Year in Review event. I would first like to acknowledge the First Peoples and traditional custodians of the lands on which we meet today. I pay my respects to elders past, present and emerging, and to any elders joining us here today, representatives of the world's longest continuing culture. And thank you to the Victorian Healthcare Association for inviting me to deliver this welcome address. The work you do representing public, metropolitan and regional and rural hospitals across the state, including acute area mental health services, forensic care, and all 28 registered community health services, many of whom provide community-based mental health support, is irreplaceable. And your work has never been so important as it is right now, because Victorians will continue to live with the economic and social impacts of last summer's catastrophic bushfires and this year's pandemic for some time to come, including greater unemployment and underemployment, increases in substance use and mental ill health, and many more Victorians living on or below the poverty line. That's why supporting the well-being of our frontline workers continues to be a major priority for the Victorian Government during our COVID-19 response. For example, our $59.4 million mental health and wellbeing support funding package included the provision of vital surge capacity for key services. We've also recently committed funding a healthcare worker wellbeing centre and improving staff, rest and recovery areas in health services and for specialist support services for workers. And earlier this month, we announced a $235 million recovery workforce package, which will create 500 new jobs right across mental health, family violence, health and child protection to deliver more frontline services for those needing support. This includes 100 new positions in alcohol and drug treatment services, additional transition places for experienced general nurses to specialise in mental health, more mental health nurse graduate positions, and funding for allied health, nursing and medical undergraduates to work part-time in mental health settings while completing their studies. As the new Mental Health Minister, I will also ensure the amazing work that's been undertaken to reform our mental health system continues at pace, because there is no time to waste. Our government is committed to implementing all the Royal Commission's recommendations and is currently implementing the 9 recommendations from its interim report released late last year. This includes $492 million for 144 extra mental health beds, as well as funding for the statewide expansion of the hospital outreach post-suicidal engagement services. social and emotional wellbeing services for Aboriginal people, and the creation of training and development pathways for people with a lived experience to work in mental health. And we are also getting started on designing the new Victorian Collaborative Centre for Mental Health and Wellbeing. I want to take this opportunity to commend the partnership between the VHA and Mental Health Victoria in ensuring that a whole of system perspective is taken in response to the Royal Commission into Victoria's mental health system. It is vital work, and the forums both organisations have hosted over the past 12 months to discuss the Royal Commission's interim report with health services have been absolutely invaluable. To everyone involved, thank you. Of course, it will take time to properly understand the scope and the magnitude of what needs to change across our mental health system, which is why this year's budget includes $868 million to ensure that Victorians can access the mental health support they need when they need it. Building a more inclusive community and ensuring people with disability and those living with mental health and substance use issues are safe and supported to live a life they value is a major priority for our government, and one that we can all work together to achieve. To everyone at this conference today, thank you for your hard work and commitment to the people of Victoria, especially during these challenging times. And thank you again to the VHA for organising this conference and for the work that you do on behalf of the Victorian community. Have a great Christmas and New Year, everyone.
I want to thank Minister James Molino for that message. And when he was appointed a few short months ago, we met him and had an excellent conversation about the role of our sector. And I would have to say he's a minister who's incredibly keen to learn. And I don't know that I've ever been asked quite so many questions by a minister in the first meeting, which I see as a very, very good sign. And also, Minister Merlino has a history of delivering reform in education. And so whilst mental health is a new area to him, the delivery of complex reform in an area that lots of people care deeply about is nothing new. So we want to continue building that relationship with the minister, and certainly it's great to hear him call out the partnership between us and Mental Health Victoria, which I mentioned earlier. It's also really important that he is continuing to reinforce that whatever those recommendations of the Royal Commission will be, they will be implemented. And we're already seeing progress on those recommendations from the interim report. And so I think we can hold them at their word and say that we will see those recommendations implemented. Of course, the Royal Commission hasn't reported yet, and we're all very keen to see what they will say. But certainly we continue to engage with the Commission and also with our members to help everybody understand the impacts, not just the impacts we already knew about on mental health, but the impacts that the pandemic has both created and exacerbated on the mental health of our community. It's also pleasing to see the Minister reiterate commitment to and focus on frontline workers. This is an incredibly important area for the success and continued sustainability of our mental health system. And it's crucial to ensure that the sector has the capacity and capability to deliver the care that the rest of society needs. This has been an issue that members have repeatedly identified during our work this year, consulting on the response and the reaction to COVID-19, and will inevitably be an ongoing area of focus for us at the VHA. We welcomed the funding in this year's budget for mental health, and indeed many other commentators, peaks and associations did so too. But of course, we will expect a great deal more in next year's budget because the Royal Commission will have reported by that point. So we have a lot to look forward to in mental health. Unfortunately, due to the pandemic, we also expect to see an increase in demand. And our system, if we didn't know this, was already struggling before COVID. So it'll be a very challenging time, but it is great to see that we are all lined up facing in the same direction. That is at least a start. So thank you very much to Minister Molino. It's now my pleasure to introduce a message from the Minister for Disability, Ageing and Carers, Luke Donnellan MP.
To begin with today, I'd like to acknowledge the traditional owners of the lands upon which we stand and pay my respects to their elders, past, present and emerging. I'd also like to acknowledge them as the longest living civilisation in the world and how fortunate we are to live on their lands. Firstly, I want to say how grateful I am for the care and support provided by management and staff for our aged care residents in this incredibly difficult year. We started with bushfires in January, with over 100 residents relocated to other public sector aged care facilities and out of harm's way. I met with some of the residents at Yarrawonga and heard about the courageous and creative ways that staff supported and cared for residents, older people and each other. The bushfires were barely out before we were facing the coronavirus pandemic and our lives were turned upside down. We know that older people are highly vulnerable to coronavirus, especially in aged care settings, which is why we worked with you, implementing supports to reduce staff working across multiple sites, payments for staff who could not attend work, ongoing testing and retesting of aged care staff, additional training in infection prevention and control, and much more. I think the pandemic has been the hardest of all on aged care residents, families and workers. You work in a high-risk industry with constant changes to procedures and restrictions. I can't thank you enough for the way you get the job done despite the challenges. The high rates of testing in particular have helped us have confidence to open up and hopefully keep open for Christmas and beyond. And really, Victorians will be able to thank aged care workers as well as the healthcare workers across the board for giving us back Christmas. The dedication to keep frontline services running smoothly during such difficult times has been extraordinary. Without your passion, your commitment, the situation would have been far worse. I ask you to keep doing the marvellous job you do because we know it's not over yet. Our public sector aged care in Victoria is the best in the country. We led the way, and that should make you proud, whatever role you undertake. And there are so many different roles that are vital to aged care. Whether you work as an RN, an EN, a PCW, in the laundry, the kitchen, or office staff, you've got much to be proud of. And I look forward to continuing to work with the Victorian Healthcare Association to advocate for a better deal for public sector aged care services at a national level and to work through responses in Victoria. It's just so important that this industry gets the respect and attention it deserves. Our dedicated workforce and older Victorians deserve nothing less. But today is about you. Thank you for everything you've done. You've no doubt saved many, many lives this year, and the state of Victoria is indebted to you for that. Please have a good break. Be kind to yourself, and let's all hope next year is a little easier. I certainly hope to be visiting more facilities and maybe get a chance to say hello and personally acknowledge your work. Bless you and thank you.
Thank you to Minister Donnellan. It's great again to hear recognition for the efforts of our sector, and in particular in that case the aged care workforce. When the Andrews government were first elected, many of you would remember that they made an election commitment to stop any sell-off of residential aged care beds in our sector, and there had been a policy previously to gradually reduce the number of aged care beds, particularly in metropolitan Melbourne. They reversed that decision, and it was Martin Foley, who is now our health minister, who was responsible for aged care at the time. And I remember having a conversation with him very soon after they were elected, where he said, "I bet your members are very unhappy with me." In fact, I think he used stronger language than that for making that promise. And my response was, our sector isn't unhappy with the promise. We just need you to stand up and provide the funding and the support we need to make it work. Because the reason we were reducing the number of residential aged care beds in the public sector was because it was so hard to make them work financially, and we were under constant pressure to do so. And he committed to trying to do that, and over a number of years I would say that the government has been as good as its word. We haven't seen that decrease in residential aged care beds, but we have also seen much greater support for public sector residential aged care, and Minister Donnellan, as the current Minister for Aged Care, has continued to push in that direction. And we've now seen not a reduction in public sector residential aged care beds, but an increase, with a couple of new publicly owned and publicly run facilities announced, the most recent being at Monash Health in the most recent budget. So we're incredibly grateful to Minister Donnellan and also Minister Foley previously to him for their support for residential aged care in the public system. As he said, we have the best public sector residential aged care in the country. I would absolutely wholeheartedly agree with that. And it's something that we're very proud of. And for many rural communities in particular, if it wasn't for the public residential aged care, there would be no residential aged care in those towns. So I think this is something that we all feel very, very passionately about. And it's great to see that the government supports that passion. It's also really important to recognise and celebrate the close working relationships between us, our sector, and the government, and the ongoing support from the Minister, as you just heard. Obviously, there are clear opportunities to continue to improve, and we saw this play out with the incredible impact on particularly the private residential aged care sector during COVID-19. And I was able to participate in a number of conversations at that time between federal and state governments, between federal and state ministers, about what we would do to support the aged care system as a whole respond to the pandemic. And obviously we saw that improve over time as partnerships between private aged care, public hospitals, public aged care, and community health services improved. And hopefully, I deeply hope that this is true. We have learned some lessons from the impact of COVID-19 on our aged care system more broadly, and we will ensure that we don't forget those lessons. And certainly the coordination between federal government, state government, and federally funded and state funded services in the area of aged care and public health is one of the things that we want to keep moving forward, because I think it's something that we've all known we've needed for quite a long time, and unfortunately it took a pandemic to really push the issue. The Minister also raised another important point. The pandemic is not yet over, and we as a health and aged care sector have to keep going at a time when services have been highlighting the impact of the pandemic and the bushfires on their staff. This is, as we said with mental health, a key area that we will keep working with services on, and ensuring that everything we do everything we can do to support staff, we do that. It was also great to hear support from Minister Donnellan around working with the VHA at a national level to advance the cause of PS-RACs, especially during the coming year when the Royal Commission will deliver its final report. It feels like a very long time since that Royal Commission was announced, and COVID time has made that feel even longer, but it will deliver its final report in the new year. And it is likely to recommend significant changes to the aged care system. We've already seen some sense of this in its responses, its interim responses to COVID-19 and other topics that it felt so strongly about that it felt that those responses couldn't wait until the final report. They were so important. And they have criticised the system overall. And I suspect that in the final report of that Royal Commission, we will see very significant recommendations made. And hopefully the federal government will do what our state government has done in the area of mental health, and will commit to deliver those recommendations, whatever they say. Although we haven't seen that yet, I am hopeful. So I want to move now to another of our key partners at the VHA. Maintaining an accurate record of staff infection control measures obviously is more important now than it has ever been, and that is why we're delighted to partner with OnePassport. And now I would like to introduce a message from them about their work across our sector.
Hi everyone, it's Amanda Edwards here from OnePassport, and I'd like to take this opportunity to record a short video to thank all the VHA members for their support during the year, and talk a little bit about some of the things that we've been involved in to support organisations with their COVID responses. As you can imagine, at the beginning of lockdown, the beginning of March this year, all of our demos and meetings got cancelled. as everybody, all you guys started to scramble to put together COVID responses appropriate for your communities. And as a person in the community, I want to say thank you. I have been firsthand in witnessing and being part of some of those responses, and it's been an incredible effort on everyone's behalf. So thank you from OnePassport, from the bottom of our hearts. So what we did initially was regroup and think about how can we support you guys as an industry. And we took our OnePassport immunise program or platform that's an immunisation register, beefed it up and added the capabilities for COVID-19 testing results, cohorting, quarantining, making that really easy for employees to share that data directly to the platform so that you reduce your admin time, and also setting it at an entry-level price so that even the smallest organisation could afford to use and utilise the system. We then released some of our people capacity to do more of the implementation and make it easy to implement the system. A lot of our clients really appreciated that extra support because you were all running and under the pump. You didn't have time to do new things. So we got that. And that was really, really fantastic. And we enjoyed that thoroughly. But what's happened since then too is a number of people have approached us about repurposing our platform and using it in different ways that we had never ever thought of. And I think that was super cool. Firstly, we were approached by the Queensland Government and Community Services Industry Association in Queensland. And they wanted to put together a job match program to respond to the sudden dearth of jobs in one area. So suddenly people lost all of their contracts and they couldn't provide work for their workers. But in other areas, new services were required very, very quickly. So, that opportunities out of devastation really, really did come to fore there. So Job Match is a bit like a dating app for employers and employees. And it's been fantastic to see people get work out of that program. Employers get really good candidates and it's going along really nicely. Next, we were approached by a number of organisations, and we've worked with universities, consulates and cultural support groups to develop Study Support Australia. And that platform is all about linking international students who are now, many of them staying over the holiday period when they would normally leave because they can't get back to their countries. And they usually work, and their work is usually casual based, and they've lost that work. There's been few supports for them. So we're linking them now with vetted and safe employers in the farming, growing and harvesting areas, because those guys usually import a whole lot of workers to come and do seasonal work. And we can't do that this year. So matching the something like 26 to 30,000 jobs that are out there with students who are stuck here makes good sense. And we're very excited to be part of that project that's just recently launched, and it's taking off like wildfire. So very, very important, as much for anything as our food security is at risk here. So, really quite passionate about that one. Then we were approached by the Pacific Islands, Vanuatu, Solomon Islands, looking to use our OnePassport travel app to track and trace, or to implement a system to track and trace visitors and people returning to country from other countries where they have been stranded. So trying to get them back, trying to get a system in place so that they can open up tourism, trade and humanitarian support. That's moving along really nicely as well. And lastly, and one of my pet projects, is the Register of Tradeswomen. That's a UK-based, a national register in the UK of all tradeswomen. And what happens with that is it's not only there to support women entering trades, but also providing referrals for those tradeswomen to other women and vulnerable families who've been affected by family violence and may not want a male tradesperson in their home. That's one that's really close to my heart. For those of you that know me, know that that's probably a passion of mine, and I am so excited to see that really growing and developing. It's just, these are projects or avenues for our platform that we didn't see or envisage at the beginning of COVID, and probably wouldn't have pursued. And I'm so glad to have been a part of them. It's been really, really exciting. So in the coming year, we're looking forward with optimism. We've been able to retain all of our staff and in fact grow our business during COVID. We've seen quite a significant scale up, and I'm really proud of the way that we've done that too. The leadership in our organisation was extraordinary. We had a number of employees who were very much at risk if we didn't support them. So it's been super satisfying to be able to not only survive but start to thrive in these circumstances. So going forward, we are optimistic about the future. We are looking forward to it. We're very reflective on the past and the lessons and the opportunities that we obtained through that. And I just want to say thank you for the support of VHA members. I look forward to talking to you in the new year, and I wish you a very well-deserved rest, safe travel, happy holidays. So see you next year.
And thank you to OnePassport. And Amanda would know more than most about how difficult this situation has been for everybody, as she used to be a director of nursing in our public system. And they are a good friend of the VHA, and I want to thank them and all of our partners, without whom we couldn't do many of the activities that we're able to do to support you, our members. One of the key reasons for hosting our State of Health Week is to reflect on the achievements across the sector. We've been incorporating different case studies and photos into the programme throughout the week so far, and we will also be unveiling a time capsule on Friday and asking you to contribute more photos and stories. But for today, we've compiled this video montage which zooms into some of the key stories you've shared through your websites, social media and media, particularly focused on the many different ways our health sector supports the needs of our community. So that was a fantastic kind of montage of the work of our sector, and I'm told, and anybody who can work out who it is gets a prize. I'm told we've got all but 4 members shown in there. Not because we've chosen favourites, but that means there's at least 120 organisations that were shown through that montage, and it's just incredible to see the work that you have all done, that your staff have all done, and so many smiling faces. You would be forgiven for not looking quite so cheerful given the year that we have had. But it's really fantastic to see everybody getting involved, providing that support to their communities, whether it's the new Mildura-based public hospital, who we're delighted to welcome back into the public sector this year, whether it's the Peter MacCallum Cancer Centre doing fantastic work for those suffering through this terrible time with cancer, whether it's our community health services across the city, across the state. It's just incredibly humbling to be reminded of just how much work you have done, just how much work your staff have done, and just how supported our community has been through this time, just as it always is, but it has been more important than ever during this time. And it's incredibly hard to believe that, that we are still at the end of this year actually still standing up, still providing those services every day. And I am incredibly grateful to all of you and to all of your staff for that and for the efforts that you've given and will continue, no doubt, to give in the coming weeks, months, and next year. Thank you to the ministers and our partners for sharing their insights today and for their continued support as the sector supports so many different areas of Victorian lives. Thank you to all of the healthcare workers who day in and day out deliver critical mental health, aged care and disability services alongside our vital health programs across the state. And thank you to everybody for joining us today. We'll be posting the videos from this session online from 12 noon. I encourage you to share them with your colleagues, particularly the messages from the ministers, to show to your teams and to your colleagues just how much support we do have in government, which is incredibly good to see and to hear, and also that montage to show people they're not alone. The incredible work that they do has been recognised and we respect them for it. Please join us again tomorrow at the same time with the same Zoom link as we look to 2021 and get some insights from changemaker Zioni Walker and hear from more of our partners and members. And also looking forward to Friday's session where we will be hearing from the Nossal Institute on a research program they've done on the reactions of healthcare workers during COVID and also celebrating all of the wonderful achievements of our sector. And don't forget, you can continue the conversation on Twitter, LinkedIn, and Facebook with the hashtag State of Health. Thank you very much. Have a great day, and I look forward to seeing you again soon.